Hello, I'm Hannah Burks and I'm in your TLA 59 course, and today I'm going to be discussing ADHD. Today is a crazy wild day. I get to go to Baltimore tomorrow to see my brother who's been in the hospital for a while, so I'm very excited for that. But I'm also very excited right now to discuss ADHD with you and some of the behavioral aspects of ADHD, how to help students with ADHD, what intervention plans we can have, and how to best advocate for these students within our classroom and in their home lives, and to help parents who are struggling with their child to be able to um, have better communication amongst each other and amongst us. So, what is ADHD? ADHD is a neurological disorder that affects how these students are able to internalize the information, and often leads them to be very witty or distracted or flighty, impulsive, just getting very far away from the current knowledge and the current topic in the classroom. And so they can be very um, irritating at times, not on purpose, but just because of this disorder. And so, as teachers, we need to realize that this is a problem that they're facing and not get irritable with them at situations like this, but also recognize that they are trying their best. And so, uh, we as educators need to try our best to try to find ways to implement strategies and help solve these problems. So, interventions for students with ADHD. Some behavioral interventions of ADHD is cognitive behavioral therapy, which is a psychotherapy that helps the individual to be able uh, to discuss with the therapist what's going on, to kind of inform the therapist on what's going on when they're thinking about things, and how they can maybe deal with situations to not get quite as distracted in the future. Metacognitive therapy is similar to behavioral cognitive behavioral therapy, and the fact that it's discussing with the therapist what's going on in your mind, but it focuses on seeing where you might have gotten distracted, and what question popped into your head to make you kind of go a different direction. So metacognitive therapy allows the therapist to see what the student kind of gets caught off guard with and what might trigger him in certain ways um, to be distracted. Psychosocial therapy is a therapy that is used on the student and their family, and it allows them to work together in order to see how maybe the family really triggers him at home, or he just gets really distracted when mom says it's time to go do dishes, or it's time to go mow the lawn, or whatever the chore might be, or it might just be getting up on time or focusing on things that she's asked them to do over and over and over again. So psychosocial therapy allows the therapist and the mom and dad and the students to be able um, to interact and to learn on different skills and strategies to work on the ADHD. Organizational skill training is used um, to help students with ADHD to help with time management. This allows them to have a better chance of focusing on the task ahead of them. And this can be done in the classroom, setting up uh, the student's desk, making sure it's all nice and orderly, that there's nothing that should distract the student, that they should be able to focus pretty well on the teacher and what content they're supposed to be learning at the present moment. It might be as soon as an assignment is done, sending it somewhere instead of it leaving it on their desk, so they have one less distraction there. It might be many different things within the organization of their house, their room, their work place, wherever it might be. Organizational skill training can be very helpful for students with ADHD. Multimodal psychosocial treatment is also used, and that involves the child, the family engaging on everything throughout the day that's going on with the student, and it brings all these different treatment ideas together to find the best mix for the student to achieve success. And so, multimodal psychosocial treatment is used fairly often as well. Um, Parent education. Um, Their jobs are to advocate, to take charge of their child's difficulties, to stand up for them, to help teachers know what's going on with their students' lives, what might be triggering them to kind of get distracted so easily. Just as much information as the parent can give to the teachers and to those who are needing that information, whether it's their daycare provider, whoever, or yeah, over the summer who's been taking care of them. But just advocate for your student and help them to know the importance of listening, but also like the importance that you have for them and how much you care about their problem with ADHD and you want to help them. Teamwork is also important. It's important for the parents to interact with the education team and the school to interact with the parents on what's going on throughout the day to day and to discuss the difficulties as well as the successes. We can't forget how students succeed, and we need to remind them of the good things they've done, um, especially with ADHD, helping keeping them focused and reminding them the times they are that you're so proud of them is so good. Comprehensive assessment as well, testing the child with assessment to look at their emotional, their time management, their medical and psychological aspects of their lives, and just focusing on everything of a student, everything they're going through for this ADHD student, and helping figure out, where they need the most support and how we can provide it to them. And research is another thing, so encouraging parents to research too, because it's their child, and their child should know that you're trying hard for them, and also just to have that encouragement of research to be able to see different strategies and different ways that we can implement and you can implement in this child's life. Medication. Medication is found to be successful for ADHD. It helps in the current moment relieve the effects of ADHD, but there has been some studies by Raja that show that they're not quite certain on medication for long term, how it will help the student, but they do know for short term anyway, medication is very useful and very beneficial for test taking, for just attention overall for the student. ADHD is a top diagnosed disorder. It's one of the most top diagnosed disorders among students, among children today. And medication is used frequently because it is known to help. Just they're a little concerned about the future of keeping medications going. But the medications they use for ADHD are methylphenidate and amphetamine, and those have been used for quite a while. These medications have been used for 70 years or more, so obviously they have been beneficial and have proven to work pretty well. So the only reason they're saying long term it might not is they haven't had a lot of research studies looking specifically into ADHD medicine over a long time. So they'd like to have more of a understanding before it's used a long term. Abuse, though, is a problem with medication. So substance abuse is not uncommon with medication use. There, obviously, students need it, so I'm not saying that it's bad. But there have been instances, I know of even one in my family, of a cousin of mine having ADHD and struggling with abusing her medication. So it's definitely something that might not happen often, but it's something that we can't overlook. Academic interventions, some different ways we can help students with ADHD in the classroom is by having a reward system. So when they follow instructions, when they do things the first time without getting distracted, rewarding them and telling them how proud we are. Students today don't hear that we're proud of them enough, I think. And also the reward system is just a great system overall to use to help students know that they're loved and cared for and that we're proud of their progress and that we're not going to take that for granted. Another way is alter the mode of instruction. So as you can see even on this picture, there are 20 instructions to do in order. And for students with ADHD, that's very distracting. They might look ahead, they might get off topic, they might start messing with one task that has no correlation with the other. So by maybe only giving them like two or three at a time, maybe even for some, just one step at a time, this will help prevent their ADHD from allowing them to get distracted in the classroom. Another thing to do is provide alternative seating. So having bouncy balls that they can sit on and squirm around in will allow them to focus on what's ahead. Maybe even just comfortably having comfortable seating, like a couch or something in your room that might allow them to like feel comfortable enough when where they're sitting that they are able to take in what they're learning. So any form of alternative seating that helps the student to focus better. Some environmental supports as well would be organizational training, like discussed before, to help students stay on task because there's no clutter on their desk. To remove the clutter is another environmental support that's needed. I think when I look at that picture, I start to think how crazy it is and how stressed and anxious I could be. I can imagine students with ADHD, if the room is full of clutter, how they're supposed to pay attention for the whole class period, and then also appropriate seating. So some individuals with ADHD really struggle to pay attention, so sticking them in the back corner where all they can see is other people talking might not be the best way for them to truly focus. So just making sure wherever you have them in the class that they're able to focus well and that there's very little distraction. They're amongst their peers that they get along well with, but aren't encouraged by them to talk more than they should, but still be present in the classroom, and just allowing all students to stay on track with very little distractions, but especially those students with ADHD. Families of children with ADHD, if a student has ADHD, it's likely one of their parents also struggle with it. And siblings also may have problems with ADHD because it is genetic. It's um, easily passed down. Keeping up with a child with ADHD is hard because, especially if you have it yourself, you're dealing with your own emotions, your own time management, your own ability to be motivated and achieving day-to-day tasks. But then you also have your child's needs that include all of those that I just listed. And so then instead of just focusing on yourself, you have both, which it's a lot easier to focus on the other than yourself, but it's a very hard life with ADHD for parents and students, or parents and their children, um, if they both have it. Thank you for listening to my presentation on ADHD. If you have any questions, feel free to email me or yeah, leave in the comments. But thank you for watching my video and taking the time to help me learn. Here's my resources, and yeah, I hope you have a great day.